What is the hardest part working with athletes? I know as a physical therapist for myself, it's trying to get people to comply with their exercise program. And I can imagine, for athletes, a little bit easier for them to stick to their exercise program. So rather than speculate, I guess, what's the hardest part for you working with athletes?
Yeah, that's a good question. I think the challenge working with high level athletes are they've got so many things pulling at them, like from so many different stressors outside of just basketball. And it's oftentimes like it's their life. And so adding additional work, quote unquote, to their routine can be a challenge. So like getting buy-in takes a lot. For most guys, I'd say, even in the higher level guys, I think even more so, because again, they've got everything at their fingertips, and they've got so many people in their ear that like the buy-in with them becomes even more important. And so I think getting them to comply is probably the hardest part. It's not as easy as you'd think.
Really? That's really surprising. I think you'd think that they'd be like, listen, I got to get better. Like, this is the only thing that's important to me. How do I get better? But it's not the case.
Well, it's hit or miss. You have an athlete on both spectrums. So you have the athlete that you got to protect against themselves, where you give them something and they'll do it 7 times a day because they're determined to get back on the court. And then you have the athlete that doesn't necessarily want to do it all, but wants to return. So they might try to, skip those corners. So both you just need to manage a little bit differently. But I think getting both to really buy into the entire plan, whether it's doing more than they are currently or less than they are currently, both sides, you gotta, get that buy-in. So it can be challenging.
Well, it seems like you're dealing more with personality at that point rather than actually like the idea of like rehabilitation and.
Yes. There's a component of that.
Well, I'm sure the athletes have plenty of different personalities, so to speak, I think is a good way of putting it. And I guess communication skills have to be huge. And I guess how have your communication skills changed since you started?
I think really individualizing every athlete. So anyone that walks in your door, or any athlete that you work with, like something is going to be a little different in how you communicate, whether it's what motivates them, what creates the buy-in, their learning style. Sometimes being very detail oriented with certain guys, and then understanding when not to be detail oriented so they don't get too involved in that. So just being able to tailor the communication style per each guy, I think has improved a lot. Because I think initially, in PT school, you're like, okay, you got to do this type of education. You communicate the injury to this person this way, and it's kind of standardized. And I think being in this setting, each guy, again, you just need to communicate very differently. And it's also especially my role as director of rehab, how you communicate with the different key stakeholders is big. So even, how you communicate that injury to that athlete, or the prognosis or diagnosis to the athlete, is going to differ than how you do it to the management, as well as to the agent and the head coach and your own colleagues. And so knowing your audience, that's the biggest thing I'd say.
Yeah, I definitely want to get into more of that later, but you had mentioned PT school, and I guess, did you always know you wanted to get into sports when you went into PT school?
Yeah, I did. I thought I did. I mean, you go into PT school with one thought, and it probably changes 10 times throughout. But yeah, I played sports in college, and high school, and I had, multiple injuries, and I knew I wanted to get into the medical field. And but I also thought I was going to be a pro athlete when I was younger, which clearly not the case. And so being able to merge the two, like being a part of a team, being in a sports setting, or working with athletes in physical therapy, just kind of became a dream. And then the more I went into PT school, and again, I got to see the different populations and work with a different clientele, the more evident it became that sports is where I wanted to be.
Did you do like clinical rotations with ortho clinics that emphasize sports, and that's kind of where you got your first taste of it?
Yeah, I actually got my first taste as an athlete.
Right.
I had a couple injuries in college throughout my career, and I had some different experiences, some good, some bad, with different providers. And one where it was very general ortho, like they treated me just kind of very general ortho, and it was kind of like monotonous. And then the other one really tailored it to what my goals were, and my sport demand and everything I was trying to get back to. And that was probably the most I had been exposed to it. And then clinicals, I had two one sports clinical, one ortho, and then one that was a little more tailored to sports. And then again, that just reaffirmed that sports was the area I wanted to go get into more.
And, straight out of PT school, I guess, what was your mindset like? Did you knew you wanted to work in sports, but I guess how did you do it is my question.
Well, I think the big thing was, I graduated PT school, and I'm like a very big believer in you don't know what you don't know. And you're not going to know what you don't know if you don't expose yourself to different people and to different challenges and not only the success. And so, as a student, there were things that I got out of PT school that when I was done, I just kind of thought I could do this. I could totally step into a role right now and be probably decent at it. But I think there's a lot more that I want to know. And so I did a sports residency at University of Southern California. And that was such a challenging year, just in regards to constantly being questioned on my thought process and my clinical reasoning, and how you can tailor your treatment to each athlete differently, and why sports is different than ortho, and just being involved in all that. So I did that. And I think that really jump-started a lot of my motivation to continue to grow and continue to learn, because the whole year was pretty much about what I don't know. And it was, again, every day was a different challenge. And so I finished my sports residency, moved back to Minnesota. I started working at Mayo Clinic, sports medicine in Minneapolis, Minnesota, and started working daily, and again, continued to be, I was surrounded by amazing clinicians and mentors and friends and colleagues that challenged me, but also like worked alongside me. And so it was a different experience than residency, but one that I continued to grow. And I was fortunate because I got to do research. I got to be a CI. I got to do the clinical aspect. I got to do some on court or on field work. And so again, I was integrated in all these different areas. And I think it kind of set me apart as a clinician, just some of my experiences. And then I stayed in touch with mentors, and I got a call from Orlando Magic about interest in a physical therapist position. And at that time I went through the process to learn more and ended up jumping in.
It was all worth it, and it led you to where you are now. And my next question would be, what's the interview process like? You built up all these skills and all these experiences working with sports, ortho, you got a residency, you were the Mayo Clinic. What is the interview process like?
Yeah, so it's been different. Both the Clippers and the Orlando experience have been different, but I think pro sports, there's a huge soft skill component. So outside of just the technical skills is that component. And so it started, I think, Orlando. We'll start with Orlando. Orlando was an initial Zoom with the director at the time, and then a follow-up Zoom with some more of the people in the department, and then an in-person interview. And that was a full 2-day experience. I mean, you fly in, it was dinner with the whole crew, just kind of hanging out, shooting the shit, and then not really talking PT. Next day was sitting down individually with different people in the department and talking about PT, talking about collaboration with different disciplines, talking about different ways I've managed athletes in the past. There was some period of time that I hung out with the front office. So my president and GM in Orlando, met with them for a couple hours and again, talk through challenging situations and dealing with agents and coaches. And so it was more so just, I think them trying to get a feel for who I was, how I practice, what I believe, how I collaborate with other people. And just to see like how I'd fit in, a role when I came from a clinic, to pro sports. So that was kind of that initial. And then the transition from Orlando to the Clippers was, similar. It was a very extensive process, and it was, Zooms, calls, in person was, I met with the head coach for a couple of hours and he asked everything under the sun. I met with the president for a few hours, asking all about different return to play protocols and how I'd handle tough situations with difficult athletes and what my goals were, and met with the GM and met with the director, my director currently, some different people from my department. I think I met with a couple athletes. So I didn't actually have to show any of my physical or like the technical skills, more so just kind of talk through I had to also create presentations and show different rehab planners and just show my thought process, I guess, and then talk through a lot of it. But
it almost seemed like they already assumed that your skills were there. It was more of like, is this person the right for this role and for our team to progress forward to possibly, win games and be successful in the future?
Well, that's the thing is, I think in pro sport, it's a small world. Both or like all pro sports are small worlds. And that's within basketball, but that's also within other pro sports. And so like they do so much intel on you. People are always like, oh, you get into pro sports of who you know, but it's not only who you know, it's how you do with the people that you know. So like, because they can ask 20 people, and if you get 5 that are negative, you might not even get a shot. And so, I think with the Clippers, like they had done so much intel on me and so much research on me. They probably knew more about me than I knew about me. So, I mean, they were coming in hot with some questions.
Really? Like, who's your uncle?
Things.
Why is he doing this sketchy stuff? I don't know.
Yeah, exactly. So again, I think at that point, like they already knew the skill set from what, I think from what they had gathered was there. But then they just probably had to, answer or ask some of the, I guess, holes. And if I answered correctly, which I think I did, then get the job. But
I mean, you clearly did. You're
clearly
there.
I did, I guess. Yes, that's a good point.
Well, you mentioned this question before, and we're talking about skills. And I guess for people that don't know, what is the biggest difference between like orthopedic physical therapy versus sports physical therapy? Because I think there can be some gray area between, when things can cross over, especially if we're talking about like orthopedic ACL rehab versus like, general ortho. So I guess explain it to us in your own words, what the difference would be.
Yeah, I think there's a ton of similarities, like in some of the fundamentals and making sure you have a strong, like anytime you're in sports, you got to have a strong ortho background and again, foundation. And you have to apply that with every sports injury, but rehab's a continuum. So it starts maybe more in the, like there's biologic constraints right away, and that's going to be more tissue healing time frame and all the initial phase. And that's going to be really based on ortho. And then it's going to transition into more of that sports specific. And that's the difference, I think, is that transitioning phase and that gap between, performance, like full performance on court or on wherever it is, and the table. But so I think that's one big piece is kind of bridging that gap. I think also, like really tailoring, being really specific in what you do and how, understanding the difference between like anterior knee pain, say it's even within basketball, anterior knee pain, or shoulder pain in a right-handed shooter versus a left-handed shooter, and how you're gonna differ maybe your evaluation or your return to sport plan, and then just being able to tailor it to their sport a lot, and then understanding the sport and like what demand they need to get back to, I think is again probably the biggest difference between ortho and sport.
Was there a learning curve to tailoring your exercises to the athlete, or did having a background in sports kind of allow you to understand like, okay, these are the muscles at play, this is the mechanics, this is what we need to improve?
I'd say both. I mean, there was definitely a learning curve. Obviously I played basketball in college. I played basketball, all growing up. I'd still worked a lot with basketball players in Minnesota. I worked closely with Timberwolves facility. And so I was around it. I was able to work, kind of start diving into basketball a little bit. So there was some comfort level, but yeah, understanding, even return to play of, okay, a player gets on the court, like the difference between spot shooting and dribble pull-ups and pick and roll scenarios, and what different, kinematic, like things you're seeing on court and how that actually can break down into what you're doing in the weight room or in the exercise room, training room. And so really understanding like the high level aspect of basketball. And then I think one big thing too is understanding when you return them, like there's levels to it. So when you return a guy to court and they practice, like part of my job is to look at the practice schedule for the day and understand which drills are going to, which stress, which area of the body or stress that injury specific or that tissue specifically different. And so, okay, they can do this, they can't do this, they can do, these 3 things. That's where I think the biggest, I guess, learning curve was.
Yeah. And I was going to say, because you had said, you keep saying return to sport. And I guess for those who are not in the rehab realm, the merit and the weight behind that statement is super important, because it doesn't just encompass like one plan. It encompasses many different like aspects of it. It's the, you know, the mindset of the player. It's the training load, like what they're doing, and everything kind of goes into this whole plan of return to sport. And I think maybe for others who aren't used to that idea of like return to sport, how would you describe return to sport?
Yeah, kind of what you said. I mean, it's all encompassing. It's the physical metrics from a strength and power perspective. It's the proprioceptive feedback. It's the court specific or sport specific demand and load. It's their conditioning, their level of their level of conditioning. I guess it's everything. It's not just looking at their knee joint. It's, you start there and you potentially isolate that specific joint or that, whatever injury is being repaired. And then you start to integrate it with the rest of the body. And then you just understand how the integration of that specific injury is going to be stressed once they do have to get back, and then building back from there. So kind of reverse engineering of, okay, this is a shooting guard with anterior knee pain who has trouble doing a step back and et cetera, et cetera. Okay, well, how do you reverse engineer that to make sure that when they do return, they return at a high level, performance and physically? So again, just being able to work backwards and start trying to introduce that as soon as possible. It's a continuum, and there's, you start day one really, but there's just going to be different kind of perspectives throughout.
No, I think that's super helpful. I think the idea of working backwards is something that I've tried to implement as well with my patients, of like, okay, what is the picture perfect idea of what this person needs to do moving forward? And once you have that idea, you kind of have a target to shoot towards. And I think that's super important, because if you don't know what to aim at, how are you going to get the patient better? If every person who walks in with knee pain, I mean, this is an ortho example, but if every person comes in with low back pain or knee pain, you're given the same set of examples or same set of exercises, you're not really tailoring that exercise program or that exercise selection towards the patient.
Exactly. Yeah. So there's, like, and even in basketball, I mean, you have, obviously everyone is on the court together, but per position, per like, a step back might be a lot to some guy, and that takes one type of load to the whatever joint we're referring to, versus a center who really needs to get that contact and the stability with the contact. So being able to really understand like that end, that what that end looks like, and then like you said, working backwards and making sure to individualize it. So I think that's huge in the return to play process.
And what kind of injuries do you see most common? I know, every sport may have their own, but I guess what are the typical injuries you see?
I'd say the top 5 are like ankle sprain, anterior knee pain's a big one. Both patellofemoral joint, as well as patellar tendinopathy. You have Achilles tendinopathy, low back pain. Those are probably if I had to throw a 5 out there, I'd say that's probably the biggest 5.
And overall, I guess, what does a typical workday look like? With maybe let's talk with in season versus out of season. When does your day start? When does it end? Are you working 7 days a week? What does it look like?
Yeah. So we kind of joke in sports, there's no like Monday, Tuesday, Wednesday. There's 3 days. It's game day, practice day, or off day. But off day for a rehab professional does not mean off day. That's when the guys come in for treatment or rehab or whatever it may be. So game day is usually, you have a shoot around in the morning, and guys come in for treatment before then. You have rehabs throughout that whole period. You have shoot around. So it's like 8 to noon, 8 to 1, 8 a.m. to 1 p.m. And then you go home for like 2 hours, and then you go to the arena around 3. Like I usually leave at like 2 actually. So you have like an hour break, and then you go to the arena, get there at like 3:30, and then start treatment again. And games usually at 7, so 7 to 10, and then you have follow-up treatment. You wait to you're the last one in the building. So usually it's like you're probably driving home around 11:30. So it's a long day. Game days are long. And then on during the game, out on the court watching, I mean, if a guy goes down on court, like I'll take him back and evaluate him. managing in-game injuries. So if a guy's feeling something during the game, like sometimes you're working on them or sometimes you're giving them exercise, whatever it may be. Practice day is, that's dependent on kind of where you're at in the season, but it's usually like 11 to 1 is practice. So, 3 hours before, 3 hours after, you're probably doing some treatment. So, say it's 8 to 5 maybe on a practice day. And then treatment day, we try to minimize, like we try to give ourselves a little bit of a break, but it's, I don't know, it's like, we try to go 8 hours after whatever time we get home. So, if you fly in, we fly out after every game or fly home after every game. So we land usually pretty late, like 2 or 3 in the morning, or land in the next city at 2 or 3, 4 in the morning. So the next day we try to give at least 8 hours just before we start. So, and then treatment, we try to have like a 5-hour treatment window. And that's always added, it's always 5, 6, sometimes 7 hours, but there's no off days. So it's it's 7 months of, you don't really get a day off in 7 months.
Nose to grindstone kind of stuff.
Yeah. Again, it ebbs and flows on which days are hard. We try to give each other breaks too. So if it's an off day and, you only have 2 guys for treatment, like we'll get out of there right after. We don't, it's not about just checking the box. Like we're in and out. So it ebbs and flows, but it can be challenging.
For sure. And I guess, being in season, you're super busy. Off season, is that the time when you're focusing primarily on, I'm sure it's a lot of preparation for the season in general, so you're not really off, but I guess, is that a time for you to catch up on other things, whether it's continuing education or trying to put out other things that you're interested in?
Yeah. Definitely. So this off season right now is a shortened off season again because COVID. So the last 2 years have been shortened and we've made it pretty far both years. So in the playoffs, so it's, kind of been shortened that way too. But you have like 3 big events. You have draft. So that's like a 4-week process of, you have draft workouts, guys coming in to work out. We do the medical screen on every guy. You have like 100 of those, or 100 kids roughly come in. And then you have draft, you have free agency, and then you have summer league. Summer league's like 2 weeks in Las Vegas, and you have summer league camp before then. So, you probably get a couple weeks off in the off season. And then outside of that, the hours aren't crazy. So that's like totally when I take advantage of catching up for season, creating all my rehab calendars, trying to create as much as you can. Cause again, during the season, like you don't sleep, you don't have much time for anything. So I try to get all of that. And then I also just try to totally take time for myself, go on the weekends, because you got weekends off in the off season. So I just totally try to like not go in. I try really hard to not go in on the weekends, but it's not always that easy. But I always go home, travel. I'll travel with players for rehab. So depending on that schedule too, it can get busy or, whatever, but it's a little hit or miss. That's why it's a little hard to schedule things in the off season or season, because things happen very quickly in pro sports.
Yeah.
So.
And it's priority, right? And that's what you're there to do. And that's what you love. So it's important that you're helping them, but also for you, I'm sure it's also rewarding. You're like, you're doing something that's meaningful to you and you're advancing your career. So I'm sure it's not really a job to you.
Yeah. And I make a big point, like even during the season, this last year I did a fellowship the whole year. So it was like a full-time fellowship during the season. Every year I try to do as many continuing education. We have a really great, like that's one very big perk of pro sports that I take full advantage of is the continuing education. So I'm taking a different course every week. I'm presenting a little bit. So I try to keep, like, that's what kind of keeps me sane, is continuing to like learn and grow and take a different course, hear a different perspective, and just kind of get away from the daily like grind, so.
For sure. And what other continuing education courses have been helpful for you in pro sports? I saw that you worked with you did the Gary Gray Institute, and you did among other things. So I guess, what were some other outside continuing education courses that helped you?
I did the Gray Fellowship, which is like a movement fellowship. I think that was really helpful. I've done a couple force plate courses. I've done so some different like sports science courses, I guess. I've done a lot of like fundamental courses. So like Eric Mira, Rich Willie, Chris Johnson, just different providers around, or just different physical therapists. Dan Lorenz. And with each of them, like a lot of it is just fundamentals and like foundation. And that's always helpful again, because you do get so wrapped into the pro sport, like the sport specific stuff, that it's good to kind of get the fundamentals. And then, yeah, I mean, I just try to take as many, and then I've done a bunch of like sports symposiums where you hear from people in different sports, and that's helpful too, just to kind of get a, big picture looking down, I guess, a little bit. So yeah, I do a lot of courses.
Yeah. And with research, one of the things that's popular right now is like multidisciplinary care and collaborating. And I guess, what's the collaboration look like for team sports in the pros?
Well, that's going to be different depending on where you're at. Like we take a lot of pride in our ability to collaborate as a staff and to work together. I mean, we're really lucky with the Clippers. We legitimately actually really like each other and respect each other. And we understand that there's such a different, like we have different backgrounds and different perspectives, and we'll make a point to sit down and discuss it and argue it. But it's always like a respectful place, and we appreciate each other's, opinion and perspective. So, yeah, we try to collaborate on everything. I mean, we don't work in a silo. Return to play is, I'm leaning heavily on the people around me of, strength coaches from a conditioning perspective to, total body strength versus just that joint versus, athletic trainers to, help with bracing or, different perspectives. Like one of the guys I work with has been around for a really, really long time in pro sport. So some of his perspective on, again, like how he maybe would tape something when we're trying to return them, is going to be very different than what my experience is versus, other people too. So it's just, yes, I think, we work really closely together, and we have dietetics that, aid in some of the nutrition aspect of return to play, and, coaches perspective. We work very closely with, our player development coaches to kind of like whatever my goals are. So if I want a guy to really work on or like build some deceleration tolerance, and I'm doing it in the weight room, that's something I might tell the player development coach to create like an entire conditioning drill or on-court drill of, whatever it may be, some sort of deceleration work or introducing defense for the first time. And then being able to, again, to work together with them. So yeah, that's one of the best parts about pro sports is you've got such smart people around you that you can lean on and just work really closely with, and you grow your skill set and you grow your view on, I guess, how to return that athlete.
Did that help you early on to be successful?
Yes. The more you can collaborate with the people around you, and people talk about ego in pro sport, and I think the more you can put your ego aside, and the more hopefully that you're in an environment that people put their ego aside. And that's the hard thing is, again, we're lucky where I'm at right now because we don't actually have that, but I've heard horror stories of some other places. And I think the more you can just continue to put your ego aside and put the athlete kind of in that center at all times, the better that all of you, the better you grow, the more you grow, the more the athlete benefits.
Yeah. And certainly, again, going back to the soft skills where, you guys are there for a reason and an objective to get the players better and, all work towards a common goal. And I guess, do you guys work as a team or maybe outline as a clinic, kind of say like, okay, these are objectives this week? Do you guys have like team huddles, I guess, so to speak, to try and collaborate what the goals are for the week or even the month?
Yeah. In regards to rehab or just in general?
Just in general. I mean, you guys all working together.
Yeah. We create like kind of performance metrics, and then we'll try to like track them throughout the season. Then we meet kind of regarding that and like kind of use that as our platform to meet on players or on processes or, I think we do well with that of like, if a key metric that you're trying to kind of consistently measure throughout the season is changing, positive or negative, like, okay, well, cool. Let's learn what we did that made it better, or vice versa. Well, how can we wrap our head around, okay, what we've done is clearly not helping this athlete. So, do we have a different route we could go? Do we want someone else to try it with that athlete? And so that's kind of the biggest thing that we do is just try to create some sort of like objective measure. It's easy to, what's the saying, like assess, don't guess. So It's easy to assume they're doing better or worse or whatever, but if you're not really tracking it, you don't know. And so we try to kind of keep that at the forefront, track something, and then just discuss it and work together to figure out a solution to get them better. But
early on, when you first started in sports, I'm curious, did you kind of have a moment where you're like, wow, this is, I'm dealing with somebody who's, this is their career. This is what they do for a living. They make millions of dollars. Was there a moment of like, oh shit, I got to know what I'm talking about. I got to make sure that I'm doing the right skill? Or was it kind of just because you had been exposed to it for so long through residencies and stuff, it was a smooth transition?
no, it definitely is, because I think, or it definitely was, because when you're working in a clinic, you don't really have the pressure of as much, I'd say, because at the end, like, you don't have the pressure of a failed rehab or a successful rehab, really. I mean, you kind of get you bring an athlete to, some sort of level, and then that athlete returns to their team. And at the end of the day, the team's at fault if it doesn't go well. It's not technically you don't get fired. You don't have the risk of your job. You don't have the risk of the newspaper, whatever.
Mm-hmm.
Versus when you're fully integrated, if they're not better, and you're the one working with them, it's pretty clear. So it's yeah, there's a challenge from kind of that external stress, or the external people, stakeholders. Again, whether it's the media, whether it's your management, whether it's the coach wanting them to return sooner, or the agent not wanting to return, et cetera. So there's a lot of different stress that all of a sudden comes to play when you're working full time. And it's, yeah, I mean, early on, still to this day, like, there are certain injuries and certain people that there's some pressure or time of the season, you're making a pretty big decision on a multi-million-dollar athlete for a big game. Like, there's a lot of stress on that. So the biggest thing is, someone gave me really good advice once. It was, separate the emotion from the fact. So with everything that you have, there's going to be facts and there's going to be emotions about how you feel about those facts. So for example, if you're debating about if a guy can return to play, like, totally try to take the emotion out of it. Keep it as objective as you can. Or if a return to play goes wrong and you're stressed about the, like, what people think or whatever, totally try to separate. And it's not easy, but separate that from the fact of what went wrong and get better from what went wrong. So that's been a learning curve, because it's not easy to separate your emotion when you're super involved in that athlete and that athlete's care, and it doesn't go perfectly or doesn't go as planned. Just staying really objective is the biggest thing that I think I've been advised, and it's been helpful.
Well, it's really difficult because we kind of are our own bias, right? We want things to work all the time. We want, we want to trust in our own skills. We want to trust in our decision making. And I can imagine, again, just how many people are talking to you trying to figure out, like, is this guy going to play or not? It can throw a little mud into the waters of, like, okay, do I know what I'm talking about? Is this what's going on?
Yeah, for sure.
And what does some of those conversations look like when you're talking to, managers, athletes? I'm assuming you have to kind of tailor your conversation to who you're talking to. And was there a learning curve with that as well? Trying to figure out, like, okay, I need to explain exactly what's going on with the athlete to the athlete, but then I got to talk to the coaches, and then I got to talk to everybody else. Was there difficulties in doing that?
Yeah. And that's still a learning curve. That's never going to be perfect, because how one head coach takes it is, I've had 3 head coaches so far, and all 3 head coaches are very different in how they like to get the information. I've had 2 different managements, and those management styles were very different from each other. One, very different from each other. Different bosses, how different bosses like different, even each athlete's agent. Certain agents are extremely involved, and that can be its own stress. Some aren't involved, and you're really just dealing with the athlete. So yeah, trying to be able to tailor, I think that's like a key piece, especially in my role now. It's like an art, is trying to figure out who is in front of you and what you need to say to that person, and how that might differ and then what you say to somebody else. And again, like, kind of when you put the fear of God in people versus when you totally make it seem like it's you kind of downplay it a little bit. You just got to know the person in front of you and how they respond best to challenging info, or so yeah, it's something that I don't think you ever I think it takes many, many years of practice to get good at that, or to become very proficient. And I'm not there yet, but it's a work in progress for sure. I've grown a lot already, so still have a long way to go, but it's fun to be able to try to figure that out.
Right. Because I can imagine if, like, let's just say you give it to straight to everybody too, those people are not going to want the straight news. They want to hear it in a nicer manner, I guess. And understanding human behavior in interpersonal relationships, that's got to be huge.
Well, and the timing of it too, like it's hard because, okay, if an athlete goes down and he's going to get an MRI, and you got to understand like how quickly things get out to the media, how quickly things get to his agent, and that agent might call my front office. And if your president and GM don't know that you're going to get an MRI, then they look bad. And so then they're calling you, figuring out why this athlete's getting an MRI, why the agent knows, but they don't know. But it's like, that can happen in like 3 minutes. Right. I mean, literally an athlete goes down, they're on the phone texting their agent, I'm going to get an MRI. I'm trying to figure out where we're going to get the MRI, what time my front office has no idea. And then the agent calls my front office and yells at them. And then the media comes out and says, athlete A is going to get an MRI. And it's like, whoa, 10 things just happened before I've told anyone. So right. You're not really controlling the narrative at that point. So communication is huge. It's one of the most challenging parts of the job is, again, the how you communicate, the communication levels, how that information gets disseminated. It's never easy.
Is there an understanding between the athletes and maybe the providers of being like, let's keep this on the down low until we officially release stuff? Or is it kind of just like take each case individually and see what happens?
Yeah. I mean, it's hard because the athletes themselves are ultimately like a key stakeholder. And so, they'll tell their agent, they'll tell their wife or their mom, and that agent might mention something to someone and all of a sudden it gets out. I mean, yeah, like for the most part, I think actually we do a really good job of that, is not letting the media know until we've made it clear. But like when it comes to an agent knowing, like you can't tell an athlete not to tell his agent, so.
Yeah, no. Yeah.
I mean, there are situations where like you'll do a return to play test. The athlete will ask for his results, and we'll say like, well, let us create a report and get back to you. And then we control the narrative versus telling them a little bit of it. And then they tell their agent, and then their agent's asking questions so being able to control the narrative is really big.
Yeah. And, now you're working with athletes. And one of the things that, I focus on in ortho is educating the patient to their level. And part of an injury is understanding what's actually going on. And so is there a education piece with the athletes that you're having to say, like, this is what's going on, this is what we need to do moving forward? Or is it just like, what's going on? Let's just start working on it.
No, I think the education is probably the biggest part of it. Because again, the more you get the buy-in, like I mentioned earlier, these athletes, like they're the top of the top in the world at their sport, and they oftentimes think they know everything too. And so the more you can, and I don't mean that in a rude way, I just mean like they get told one thing, or they've had a similar injury and they assume they know, but they don't. And like a lot of times they want to learn if you do it the right way and at the right time. And so education and athlete buy-in is one of the biggest soft skills of pro sports, that I think if you can really tailor the trust and the communication to educate that specific athlete, like then you're going to get so much more buy-in in the rehab process.
Yeah, I can imagine.
You get more buy-in and the trust piece is big. So the more you can educate and show them why you're doing what they're doing, why they're doing what they're doing, is really big.
Yeah, I'm thinking myself, if I became a pro athlete and then someone came up to me and is like, well, you've been doing this wrong the entire time, I'd be like, what the heck are you talking about?
Yeah. Yeah. Or like if, think about an athlete going into a sport. If a coach says, we're going to do zone defense, and say an athlete doesn't agree with that, like the athlete has to understand why, or they're not going to put the same motivation. Or if, from a defense, from a like perspective, from a coach's perspective of what that athlete needs to do, and all of a sudden coaches just start running drills, but there's no real like rhyme or reason, or the athlete doesn't know the rhyme or reason, there's going to just be a different level of concentration, motivation. So it's no different than they need education from the coaches. They also need education from us on why we're doing what we're doing.
Just educating everybody, basically.
Yeah. Yes. Yeah. The more transparent, the better, I think.
And on the side of treatment, I guess, are there tools available to you guys being, because I know in like in the military, you're able to ask for imaging and prescribe analgesics, I guess. Are there things available to you guys that you're allowed to do because you're in pro sports that help with the rehab process?
Um, I think you're going to have more resources in pro sport, most likely. Like we have access to a lot from a continuing education standpoint, from a like physical tool standpoint of force plates, biodex, 3D kinematic, assessments, different load tracking. So we have Connects on, heart rate monitor. Not that that's that cool, but you have it all. And so you can add so much more to the process to get a better understanding. And there's ways to do it in the clinic, but you just have more availability, and you have more available. I don't know how to say that, but like your network is also, you have a pretty good network because of what you do and where you're at. People probably respond a little bit quicker maybe. And not that that's right, but I just try to take advantage of the tools around me and again, try to help the athlete in whatever way I can. But whether that's through a network, whether that's through, tools that aren't necessarily in our facility, but at a local clinic or whatever. Yeah, I mean, we're lucky to have a big budget. And so, especially with the Clippers, like our owner is all about getting the athlete better. And if it requires an additional tool, we're pretty fortunate to be able to have access to it.
Have you had the opportunity to work with athletes who've undergone like stem cell therapy or anything like that, or no?
Yeah, we're fortunate. One of our team doctors is like pretty world renowned with regenerative medicine. So we've done it all. Yeah, PRP, stem cell, embryonic fluid, epidurals, different. Yeah, but yeah, everything.
And we talked about analysis, and one thing that I thought of was, I think was it Zion Williams, when he was going through, when he first got drafted, they were saying how his running style and the way he jumped and things were just not as efficient. And I guess, are you constantly monitoring the patients or the athletes to figure out like what are more efficient ways to do things? Or is it more of just like as injuries come up, we're addressing the fires then?
Both. So, I mean, we do like preseason assessments on every guy kind of to get a baseline and then to also be able to kind of mitigate risk as much as possible. And so, if there's anything that really stands out, like kinetically or kinematically, with that athlete, we'll try to address it. In their, whether it's in their weight room routine, whether it's, in the rehab setting, whatever it is, that's assessment is anywhere from a standard orthopedic assessment to sports specific assessment to movement. And again, the strength, everything. So we're able to really tailor each person's, like we have a different strength routine for every player on the team. We have a different rehab routine for what manual work they do, what corrective work they do, what mobility work they do. So yeah, you're really able to tailor it. And then you just need to know like when to correct something and when not to, if that's their norm. And these athletes have been doing it for a long time. So I try not to like change a guy's shot. If, I'm not gonna go try to change a guy's shot when he's 25 and done it at a super high level, right. Unless there's an injury risk associated.
Navigating all this, how do you stay organized? I mean, you have so many freaking things on your plate. Where are there skills you have adopted that over time where you're like, this is the best way to do it? Are you still learning? I guess describe to me how you stay so organized and on top of it.
Well, I'm really type A for one. So I'm I'm just very, you can let things fall through the cracks really easily because things happen so quick and you're on the move so much and you're not home. We travel 41 games a year and you're in a different time zone, you're sleep deprived. So I try to just check every box I possibly can, whether it's, I create rehab calendars and daily medical report and daily treatment notes. And with that, I track every single thing that I do. And so, say an athlete says, oh, well, we didn't do that. Or, an agent says, whatever it is, like you're able to track everything you do. And I just try to do it when I can. So like, if we're on the plane, we're lucky we got internet and stuff on the plane. Like I'll knock things down the plane, or if I have an hour to kill and a player is not there, like I'm going to do my notes right then. And I'm going to just take advantage of the time. Because the thing about basketball or just pro sports in general is it's like a hurry up and wait. It's like you go from 0 to 100. And so when you got to take advantage of the kind of the downtime to get caught up, because it can flip so quickly to 100. And all of a sudden, if you're not caught up and 5 more things fall on your plate, you're kind of screwed. And so I just try to take advantage of, I don't really have a life. I'm kind of lame. So I just try to do, like, I'll do it at home. I'll do it on the weekend. I'll do it. I don't have the luxury of having a family or anything. So I don't like when I have an off day, like I'll usually be at work longer than I need to be, just trying to get caught up. Cause again, things just fall through the cracks too easily, and you can get behind so quick if you don't try to stay up. But I think there's probably more efficient ways that I could figure out.
We all could. I mean, we all could, right?
Yes, it's a work in progress.
Yeah. And there's always little things you can always improve upon. And I guess you've been working in pro sports for a while now. How long has it been? I forgot.
This is my 4th year.
4th year. And I guess what's next for the field of sports? Because I know more recently sports physical therapist is not new, but it's kind of a new area. And I guess, where do you see the field progressing moving forward?
I think like even my time, and then even from hearing about before my time, it evolved so much. It's evolved with the technology, and it's evolved in the level of like skill sets of different providers and the integration. So I think it's just going to keep growing. I think we're going to continue to get more technology. And then, hopefully not losing also it's all about, it shouldn't be all about technology. But you really do have, you have video of every single thing that goes wrong. Whether it's an injury, whether it's, when a player starts feeling something during a game, like you have the ability to see 10 different angles of that specific fall, or when they start feeling it, and be able to track everything. And so your ability to stay really, really to individualize it and to just not miss things, I'd say is I think a lot better than what it was, 20 years from now, or 20 years ago. And I think it will continue to evolve.
Do you think?
And then stats are getting bigger too.
Stats?
For better or worse.
Yeah, I know people do like data analysis for that specific role for teams already, and they say, okay, well, if you shoot from here, it's going to be way better, or if they shoot better on like a Wednesday night in their time zone or something like that. Like they can get down to the exact. It's the science is absolutely insane.
Yeah, so I think that's where it's going to go, is people are going to understand each other's role more and be able to work together. Because like even for us, I mean, you talk about our analytics department. I mean, you can get, like, if you're return to play a guy, they can tell you exactly what the average stint is that they play without continuously without a break. So you can tailor your conditioning test your conditioning to be 2 minutes, 15 seconds, which is the average time before a timeout, and then you give them a 2-minute timeout, and then you put them in it back, it's like, all that. And so you can tailor it so much to that athlete. I think that'll continue to get better the more you work together.
Yeah. Are there scenarios where perhaps, athlete comes in, they sprain their ankle and it's not too bad, and you're like, get out there? Or is it most of the time you're trying to preserve and try to make sure that they're not going to injure themselves more?
No, you hit it right on the head. Like there are definitely times where you're like, you're fine, go play. But there's so many contextual factors, like timing of the season, the importance of the game, that specific athlete, their injury history. I mean, what the actual injured tissue is. So, how you treat, pissed off anterior knee joint versus an MCL sprain, and the risk associated with each, and like understanding what you're comfortable with that risk being. But it's all risk reward. And then again, it's just understanding all the context that goes into it, and that athlete's feedback. I always would educate the athlete on the risk. And if an athlete's not comfortable, I would never push them unless it was something where the risk was so low and that athlete would benefit from a little bit of a push. But you can't make a player play if they don't want to.
Right. And I'm sure that trust thing comes in huge at that point, right?
Exactly. And that's where, if they don't trust that you have their best interest, like you lose them for good. So, I would never, if a player doesn't want to play, the team's trying to make them play, you ultimately got to be the player's advocate at that point. Cause you try to force a player to play and God forbid they do, and they get further injured, you've lost that athlete. So, and potentially the rest of the athletes. So,
right. Have you had scenarios like that before?
No, but I've heard of no, because I really am pretty mindful about, again, not pushing a player. I mean, I've definitely pushed players to play when I've seen, like when there's some contextual factors on why they don't want to play, whether it's financial reasons or whatever it may be. I'll just share the objective, like try to stay objective. But I've never pushed a player to play that actually has a risk associated with playing, because I've heard of specific athletes that have kind of been pushed to played and then further injured it or made it a lot worse. And yeah, that's not a good
scenario to be in.
No.
Yeah, a lot of consequences with that for sure.
But it's easy because you get so much pressure from, I mean, again, I'm lucky because like our organization's not going to push it. Like we really believe athlete comes first. We're not going to push an athlete. But I do know coaches around the league that would be like, no, this athlete needs to play. And if you don't medically think it's okay, then you're fighting with the coach, and then it's, you're in a tough spot. So I'm fortunate we don't have that, but.
Yeah, I'm sure there can be a lot of butting heads. I mean, especially like playoff games 6 or 7, and they're like, listen, I got to play. And you're like, well, I don't know. And then they going out there anyway. It's got to be like that.
Well, and that's almost like a little easier is when you don't think it's like the perfect scenario, but an athlete like really wants to play. You got to essentially like give the risk. And then there's going to be black and white situations where you're like, no, you're not going to return.
Right.
But there's that soft piece too, where they could probably be okay returning and they're really wanting to return. It's a really big game. And again, the risk is pretty low. You got to weigh that. So.
Well, part of your job is working, for the athletes, for the team, and basically, putting yourself to the side so that way everybody can move forward together as the collective. And I guess what's next for you in your career? Like, what do you want to do and accomplish in the next like five years, would you say?
I would like to oversee a whole medical department. So right now I oversee, the rehab. I think what's next is probably being like a director of medical services or, oversee, eventually it would be oversee the whole department, medical, performance, sports science, everything. But yeah, I think next would be overseeing all medical operations.
And having been in the field for so long now, and, let's just say you had the opportunity to talk to yourself straight out of PT school, I guess, for people who are listening, what would be some advice that you could probably give yourself?
Going back to something I said earlier is you don't know what you don't know. So continue to put yourself in situations where, who you're around or what you're around is challenging you on a daily basis, and just don't have an ego. Like be open-minded to continuing to grow whatever stage of career you're in. Cause, every day I learn something new. And if you don't keep an open mind to it, then you're going to miss out on a lot of growth. So I would just say, yeah, just be open-minded to continue to grow.
Love it. And I appreciate you taking so much time to spend with us today, but we're going to close out with a few questions. And if you're ready, we can get started here.
Yep.
All right. So first question, if you had the attention of everyone in the world for 30 seconds, what would you say?
I would say be kind to everybody. Kind of what I just said, be humble, continue to grow, continue to learn, and be genuine.
Perfect. Not even 30 seconds. So everyone would be like, all right, this is great. We can leave now.
I might have changed that answer if I had more time, but yeah, no, I think that's probably about what I was.
I think you had more than enough advice throughout the podcast for people to learn from anyway.
Hopefully.
And second question, who is the most famous person that you met at a basketball game? Perhaps maybe the most starstruck, most surprised, explain.
That's challenging, but we're fortunate. We meet a lot of people, but various actors, actresses, politicians, athletes. I'd say probably a couple of my like big ones that I was excited to meet excited to see were Justin Bieber. And Michael B. Jordan was a good one. And yeah, probably some different football player. I mean, yeah, probably them for now.
I think that's a pretty solid list right there.
Yeah. So we're lucky to see some pretty exciting people.
And, how can more people know more about what you do and perhaps maybe follow you as you advance in your journey with the Clippers and so forth?
Yeah, you can follow me on social media. I'm not a huge social media presence, I'm not gonna lie, but I have social media, so you're more than welcome to follow. But okay, my Instagram is magsb55, and my Twitter is Bryant5Maggie. Who came up with those names? I don't know, but
it was a past Maggie who figured that out.
Yeah, I think so.
Well, thank you so much for coming on the podcast today. I really appreciate it. So much great information, and I'm sure a lot of people are going to be able to learn from what pro sports is about and everything associated with it.
Yeah, and feel free. If anyone has any questions or wants to follow up on any of the things I brought up, then feel free to reach out at, again, any social media or anything. So
perfect. Well, thanks again.
I appreciate you having me on, though. Thank you.
Of course. Yeah. No,
fun to chat.
Yeah, it's been great. I think I've honestly learned a lot, and a lot of the questions I had for probing were it was good. So I appreciate it.
Yeah, of course.